Hello.
Hello.
My name's Danielle. I'm your nurse today. I'm going to be discharging you from the hospital. So, during your hospital stay, we couldn't rule out whether you had a stroke or not because you have metal within your back from previous surgeries that you had. It is possible, though, that you had what's called a transient ischemic attack, which I understand that you've had previously. This occurs when blood stops flowing to a part of your brain, and it's only for a short period of time, so you aren't left with permanent brain damage. However, a transient ischemic attack, which is going to be shortened as TIA, can often lead into a stroke, which is often called a brain attack. And this is from a lack of blood flow to the brain. So there's billions of little blood vessels that are in your brain, and they deliver oxygen and nutrients, and that's what helps with your brain to work. And when you have a stroke, the blood flow is interrupted for a period of time by a blockage, which is why you're on the baby aspirin, which is to help with um, like causing the clotting factors within your blood to loosen up, so it's harder for a clot to occur. So it helps with keeping the blood with flowing. um, some ways that you can look for a stroke, and that's what I primarily want to teach you today, are the signs and symptoms. And we're going to use the acronym FAST. So F is going to stand for facial drooping. So you want to be able to look into a mirror, and if you notice any differences in your face, typically on one side of the face, or if you notice any weakness at all in that side or anything like that, that's one of the primary signs and symptoms of a stroke. Another symptom is arm weakness. So if you put your arms out like this and you happen to notice that one is like drifting down or drifting off to the side, yep, just like that. That could be a sign as well of a stroke occurring. Um, the S stands for slurred speech. So when you're talking and you notice that it's more difficult for you to pronounce words, or just to talk in general. Sometimes you may also have difficulty with understanding speech of others. That's another big one. And then the T stands for time. So it's like really, really important for you that as you notice the onset of the symptoms, that you go and you seek emergency help, because the longer that you are without blood flow to that area, the more damage that you could cause. And when you're noticing these signs and symptoms, you want to also be paying attention to the timing that the symptoms have occurred, not just like when you woke up or anything like that. So if you went to bed and you noticed any possibility that you were having any of these signs or symptoms, you want to take note of the time as well, because that way the timing can affect your treatment plan as well. But they want to try to catch it as soon as possible. The primary way to tell if you had a stroke, though, is through an MRI. And unfortunately, as I said, we weren't able to provide you with that because of the metal within your spine from previous surgery. So it's going to be especially important for you to really be paying attention to these signs and symptoms. Um, do you have any questions regarding that?
No, I don't think so. You explained it very well to me.
Okay. So besides that, besides the fast, you also, the other signs and symptoms of a stroke could also be having difficulty seeing in either one eye or both eyes, as well as if you have any trouble walking, or if you have any dizziness or loss of balance, loss of coordination, and as well as like a sudden severe headache. So I definitely would strongly suggest not playing off any of these. And if you have any doubts or questions, to either call your primary care physician at any time of the day, or to not hesitate and go to the emergency department. Some ways of reducing your risk of a TIA or a stroke is limiting your alcohol intake, controlling your blood pressure, which I understand you've previously had hypertension or high blood pressure, but it's been under control now without the use of medications. controlling your cholesterol levels, which have also been pretty good. You don't smoke, which is also a good one, so I wouldn't get into the habit of picking that up again. As well as controlling your diet. They had you on a regular diet while you were in here, but I would suggest maybe following like a cardiac type diet, just because you have problems with um, like thinning of the blood vessels due to like buildup in there, and things like that, and just because you are at a higher risk since you've had a TIA in the past. So maybe just watching your salt intake, being more conscientious of picking like leafy greens or veggies, fruits that haven't been like saturated with salt or have preservatives in there. But like picking those is like your main source of like what's on your plate are going to be 2/3 fruits and veggies, I think.
Okay.
So that would be pretty good. Do you have any other questions?
None that I can think of.
Okay.